Okay, so yes, welcome to our first installment of Let's Talk Culture 2022. This is a seminar series which aims to promote culturally responsive practices in the mental health and well-being space. This year, Ishar will be hosting 3-part seminar series on neurodisability and its impacts on the CALL community. Today's seminar will be exploring ADHD in adults and the multifaceted barriers impacting the CALL community. So our first speaker will be Jamiela Sungkar. She's a psychologist in private practice and is driven to ensure that people have access to effective psychological treatment that enables them to heal intergenerational cycles of trauma that plague our communities and feed into the current mental health crisis to promote the best possible outcomes for generations ahead. So, Jamiela is keenly interested in complex trauma, ADHD, domestic violence, women's health, and perinatal mental health. She provides eye movement desensitization reprocessing, Schema Therapy, Mindfulness, cognitive behavioral therapy, and circle of security. She will be presenting a keynote on the topic of ADHD to increase awareness about its symptoms and myths, impacts, treatment options, cultural considerations, and helpful recommendations to improve the accessibility of specialized ADHD care in the community. So just to note that we do have a Q&A section at the end of the session, so if you guys would keep your questions to that, that would be great. So if you'd like to join me in welcoming Jamiela to the podium.
Thank you for that warm and wonderful welcome. I'm really pleased to be here today, and it's an honour and privilege to be in a room full of people who are really interested to know more about ADHD. For so long it's been flying under the radar and people have been left suffering in silence. So I'm hoping that today we can start to unveil some of the layers that impact people with ADHD in the community, and particularly for the CALD community. So again, welcome to the Let's Talk Culture mini-series on neurodisability. I'll be talking specifically about adult ADHD and the barriers facing the CALD community. I'd also like to thank Layla and Ishar for inviting me to speak today, and to the Mental Health Commission for funding this important series. This mini-series couldn't have come at a better time, as October is the ADHD Mental Health Awareness Month, and there has been a lot of excitement around the new guidelines being released as part of the evidence-based practice guidelines for ADHD, which has been developed over the past 2 years by different experts in the field. And I know that it was really challenging for them to put that together, particularly in light of the pandemic. So we hear a lot about ADHD in the community, and people often joke that they themselves might have ADHD, if we're rushing out the door or we're feeling a bit disorganized day to day. But really, ADHD as a disorder is very different from those more minor features that you can find in general people's behavior. So ADHD has become an area that I'm very passionate about. My experience originally started in women's health trauma and perinatal mental health and domestic violence. However, over time, I have seen more and more clients coming through the door in my private practice who are really struggling with ADHD, and particularly a late diagnosis. Along with their ADHD, I have noticed an interesting prevalence of complex trauma that can significantly impact their sense of self and well-being, and significantly stifle their ability to reach their full potential. I have also just been through the diagnosis process for my 9-year-old son. 10 years old. He just turned 10 the other week. And with this, I've developed an even greater appreciation for the hurdles that families face when they have children or the people that they love suffering with ADHD. It's very emotional at times. And also the commitment it takes to give them early intervention and proper treatment. However, our ability as a family to provide that early intervention and treatment is a privilege, because ADHD treatment and diagnosis processes are out of reach for many local families. Due to the limited services available, the long wait lists, and high costs involved in accessing care. This is why today is so important. I believe that we need to develop a greater understanding of ADHD, to ensure that adequate resources are made available in future, and so children and families no longer need to experience the suffering and heartache that can come from undiagnosed and untreated ADHD. ADHD has a significant impact in the community and across the nation and globe. Over 1 million people have ADHD in Australia, and it's prevalent amongst 5% of children and 2.5% of adults. And again, we can take these statistics cautiously because across the research, statistics varied so much that I ended up having to choose something that was most relevant. But we also know that there's a lot of people struggling in the community who are not included in these statistics, so I suspect it's a lot higher. It significantly impacts families, schools, and the workplace. And recently, as part of the clinical guidelines process, Deloitte conducted a full evaluation of the economic and social impacts of ADHD, which was estimated at $20.42 billion per year, or $25,071 per person with ADHD per year. And that's a huge cost to the nation and to our local communities. The other issue that can have a significant impact amongst people in the community is the stigma, misinformation, and myths that remain very prevalent. So some people can go their whole life struggling and finally be recommended to go through the diagnosis process for ADHD, and that's a great move. However, when they go back to tell their family, friends, or colleagues, they can often be met with really unhelpful myths and judgment, which can actually leave them feeling quite alienated and isolated. So these are important considerations to hold in mind. In terms of the history of ADHD, it was originally founded in 1904 by pediatrician Dr. George Still, and it was originally identified as attention deficit disorder. However, this was revised to ADHD to include the hyperactivity and impulsivity symptoms in 1987. So there were 3 subtypes that later got included in the Diagnostic Statistical Manual, which is a bit like the Bible for mental health. And what they ended up including is a combined type, so having the inattentive and hyperactivity impulsivity combined type, which can be a lot more severe for people, or they can have predominantly inattentive types of ADHD or impulsive and hyperactive style of ADHD. But despite these progressions over time, ADHD in the community has still faced multiple barriers. It's really not discussed openly, and there's been a lot of lack of awareness over the years. I remember even when I was studying during my psychology degree, I didn't even know really what ADHD was, which is really sad. We heard so much about depression and anxiety and even autism, and all my peers at the time were so interested in autism, and I was really struck when I was doing my placements through my postgrad training when I got involved with ADHD WA to find that actually it really is on par and equally significant to disorders such as autism. However, it hasn't got nearly as much funding, awareness and campaigns around that to support families in the community. So that was another observation over the years, and that's only been in the last decade. And I know that even ADHD WA have been fighting so hard to be recognised and to get more research funding, but again, they said that it's just been so difficult. It is a lot better than it has been, but we still have a long way to go. There are also multiple barriers to people accessing early assessment, intervention and treatment due to, as I mentioned, that lack of awareness and services in the community. And also, as mentioned, the research can be difficult to be funded. So what is ADHD exactly? ADHD is known as attentional deficit hyperactivity disorder, and it is a neurological disorder. And it significantly impacts the CEO of the brain. So in terms of the 2-part brain, we have our bottom brain, which is really the fight, flight, survival brain, and then we have the top brain. And if you think of a CEO and all the great things they do, we really rely on that to function day to day. However, with ADHD, they can't rely that that's going to stay online. So they'll go through their day with their brains going like this, and one moment they really focus, and the next minute they lose all of their knowledge, all of their skills, and they can't even collect their thoughts to have a conversation. And you can imagine how distressing that is for people as they go about their work days or their time with family and amongst the community. It's also a persistent pattern of inattentive and hyperactive and impulsivity that interferes with functioning or development. So again, you may have children who are really smart and intelligent and capable, but then when they sit down to do a test, they may fail. And then they have that repeated experience over time, which can significantly impact their sense of self and self-esteem. Symptoms also deviate from normal development and can negatively impact their social or academic activities, again, because they can struggle to pick up on social cues and the nuances of social interactions, or they can struggle to pick up on things in class or at work. It can really disrupt those domains of their lives. And generally for a diagnosis, we're looking at 6 of either the inattentive features or the hyperactivity, impulsivity features, and usually the symptoms need to have been present before the age of 12 for it to be considered a valid diagnosis. And as mentioned before, ADHD does cause neurons to fire inconsistently, which causes those everyday difficulties with brain functioning. And it is not something that can be consciously controlled. And I think there's a lot of myths that people can choose to be more organised, they can choose to be on time, they can choose to listen more attentively when they have ADHD, but that's just not the case. They're dealing with the demons of their neurons, and that can be quite unpredictable and unreliable for them at times. The risk factors for ADHD can be low birth weight, history of neglect or abuse, multiple foster homes, a neurotoxic exposure like, mum drinking while baby's in the womb, disrupted attachment early on. And there's also a strong hereditary component. So for me, my son's been diagnosed, so I have to think to myself, is it worth me, going to see if I also meet the criteria? And so it's very common that I'll get clients coming in who will be diagnosed as an adult because dad got diagnosed or a sibling got diagnosed, and then before you know it, most of the family's been diagnosed, and all of their life starts to fall into place. For them, life felt quite chaotic and didn't quite make sense before the diagnosis due to the challenges that they faced. And then all of a sudden, when they get the diagnosis, it can really help them make sense of their life experience and also the dynamic that they had faced in their families of origins, especially when there's multiple people diagnosed. So the inattentive symptoms of ADHD can look like careless mistakes or struggling to pay attention to details, difficulty sustaining attention in tasks, and not seeming to listen when they speak, when they're spoken to. So it's very common that my clients will struggle with holding a conversation because if they actually stay in tune with that person, they then lose their own thoughts and then can't respond in an effective way, which leads them to sort of scanning the room or getting distracted on that artwork on the wall. And then people find that quite rude, and so it disrupts their ability to develop and maintain healthy relationships and friendships. They also struggle to follow through on or finish important tasks, including work deadlines and important matters in their life, which can lead to dire consequences when they're important matters, like if they forget to renew a driver's license or they forget to submit their uni assignment because they left it to the last minute, then they can end up in uni for a decade instead of 3 years. So it has lasting effects on their lives. They can also avoid or be reluctant to engage in tasks that require sustained attention. So I often have clients who might love architecture and they'll be happy to research in depth all about their love of architecture and design. However, if you ask them to do their errands and run, to the post office, they'll put it off for weeks and weeks on end. And again, that can cause a strain on their relationships and way of living. And mental health, because they're constantly then in a state of fight, flight, trying to catch up and feel like they're chasing their tail. They can also lose things that are necessary for their tasks and activities or get easily extracted by other things in the room, and they can be quite forgetful in daily activities. So they might run out the door, forget 3 things, have to run back, get in the car, forget something else, run back, get to work and realise they've forgotten something else and have to get a partner to drop it off or start their day without important material. So those are some of the practical, examples of what they deal with day to day from my experience. It can also lead to significant loss of financial resources because if you think about losing a lot of expensive items or causing damage, then they're constantly having to spend money on replacing these things, and that again can cause quite significant stress in their lives. There's also the factor of having to mask throughout their day. So I have a lot of clients who are very intelligent, but again, because their neurons are firing so inconsistently, it's a real struggle for them to get through the day. So they find they often get into a flow state late in the afternoon, which leads them to work late into the evening, which then pulls back their whole sleep cycle, and then they sleep in, and then the whole thing's starting again. and their bosses are calling to say, I gave you these tasks to finish today, and they can't answer for the 3 or 4 hours that was spent procrastinating or losing track of what they actually need to do. And often they know what they need to do, but because the CEO of the brain is being inconsistent, they can't actually put it into action, and that's the real struggle. So they'll have a list of things to do, but they just can't get it into action for the day. And again, you can see how that cycles into features like exhaustion, depression, withdrawal, because as they get to the end of the day, they don't even have time for self-care. They don't get the time to organise or have any time to organise their nutrition, their meals, or connect with friends. And then that feeds into that cycle of feeling socially isolated and alone. So the other component is the hyperactive and impulsive symptoms of ADHD. So this can be viewed with seeing adults fidgeting or tapping with their hands and feet, or leaving a meeting abruptly in the middle of an important conversation, or jumping from one activity to the other. I've had so many clients come in excited about a new project because they've decided they're so passionate about art and they want to start an art business, and they go out and spend $10,000 on all the latest gear, and then next time they come in, they decide, no, that no longer interests them, and then they go into another hobby, and it could be golf or something completely unrelated, and the cycle goes on, and they get distressed because they want to be able to focus on a hobby or a business in a meaningful way, but often it's so stop and start and so disrupted that it really impacts their ability to live a full and meaningful life. They can also make impulsive decisions or purchases or choices. So partner might say, hey, can you pick me up some milk on a Sunday morning? And they pop to the shops, they come back with 2 or 3 bags of groceries, and they didn't get the milk. And again, you can see how that causes a strain day to day. Or they might go out and decide that they want to spend thousands of dollars on something that's just not a necessity. And again, partners can get quite upset and distressed. And I've often seen marriages and relationships breaking down because of this, especially if the partner doesn't want to get help. There's a lot of people who are high functioning. They could be lawyers, barristers, CEOs, and they function very well professionally, but then in their home life, it's really just falling apart. And it's almost like having a teenager in the house or a child, and the partner really feels like they're having to baby their adult partner, which you can imagine doesn't leave much room for intimacy or connection because they feel like they're in a relationship with their own child, the dynamic just gets very interesting over time. So they often blurt things out before the question has been completed or have difficulty waiting their turn, and they often will interrupt others mid-sentence, which again can cause them a lot of difficulties connecting with others and understanding and having helpful conversations. Some other themes that I find with this feature of the ADHD is their tendency to overcommit or have to mask throughout the day. So they'll take on 1 trillion projects, they'll feel really driven one week and get on top of it, and then the next week everything just falls to pieces. But because they're having to mask that whole time and overcompensate, it leads to huge amounts of exhaustion. And then they sort of go into this depressive or recuperative stage to try and get back their energy, but then because they've taken that time away, they feel like they have to then go back and overcompensate again, and then they can get caught in this cycle, which is really difficult for them to manage day to day. Even things like showering can be difficult, or getting out of bed or having breakfast. So sometimes it's really just having that self-compassion and going back to basics of what is manageable today, what is manageable this week or this month, and really starting to question some of those commitments that they might take on unconsciously that really put a strain on their well-being and life. I've had lots of clients who might have a full-time job and they do a volunteering role on the side, and again, that consumes all of their spare time, and then they don't have any time to actually look after themselves. So that's a common feature as well as part of that kind of impulsivity and decision-making. So there's also another theme that I've noticed around this with social media. So I've got a lot of young clients, and they really struggle with their relationship with social media. So it's not uncommon that they'll come in bright and sparky and tell me about their day, and their day often starts with waking up at 10. They might be a uni student. They then spend 2 hours scrolling on TikTok. And by that stage, they might get out of bed to have some breakfast and have a shower. But then that's too much. that's overwhelming. And so they go back onto social media and they might label it as time to relax or time to chill out and unplug. But actually, when you look at it deeper, it can really interrupt their ability to go to uni, pass, and actually live that progressive life. And so then they might spend the whole afternoon, on social media. Then they might go for a walk, but then they're exhausted and they're on it again. So really, it can be from anywhere up to 6 or 8 hours a day, which is huge when it's compounded over time. And often I think they understand the impact, but it's very difficult for them to put things in place to override that impulse to constantly be on the phone. And they're also seeking that dopamine because their brains don't develop enough dopamine throughout the day. They're really seeking that dopamine hit as soon as they wake up, but sometimes from the wrong sources that can perpetuate their symptoms. So the implications for adulthood ADHD means that they can often present with comorbid symptoms of anxiety, depression, addiction, and a whole host of other difficulties, which Layla will outline later. There can also be a history of misdiagnoses leading to inadequate treatment. So I'll often have clients come in at 27, 30 and say, finally, this makes so much sense to me that I have ADHD. My whole life I was told I was depressed and anxious and that I just needed to get on with life. And now that I've had this diagnosis and proper medication, I can actually, for the first time, read a book from front to back without getting distracted and actually enjoy my days. So it can have a huge impact when they don't get that early intervention. The other feature in late adulthood diagnoses is the significant grief and loss over their history. So a lot of time is spent in therapy really going back through their life and really developing a cohesive narrative that makes sense in light of their new ADHD diagnoses. Because for so long, they've been told they're lazy, they just need to get it together, they're stupid, they're not intelligent, and all of these horrible things. And so the shame and the guilt and the negative self-talk is so overwhelming and pervasive that we really almost have to go back from, infancy almost and rewrite this whole life experience they've had so that it's cohesive, it makes sense to them, and it's more empowering and takes into consideration the impacts of ADHD all along the way. It can also limit their ability to reach their full potential. So I've had very intelligent clients who were very gifted academically, who then went on to pursue, a PhD in the medical field, and at the last point of their PhD, they've had to drop out because they weren't diagnosed with ADHD and they just could not submit their thesis or they could not meet those, last few deadlines. And they're devastated because that's their life's work. That's what they're passionate about. And then they've got to go and sit in a room in Department of Health or other, universities and medical facilities and sit with a whole bunch of colleagues who've finished their doctorates and PhDs. And so they're constantly faced with feeling like they're looking at all the things they haven't achieved. They also tend to struggle interpersonally and socially and professionally because of all of the shame, the overwhelming shame and guilt over the years. They can really get caught in their head trying to control and analyze every interaction, which again can be quite crippling for them. And as I mentioned, there are those pervasive themes of low self-esteem, worthlessness and hopelessness for the pure fact that they haven't been properly treated all these years and they've really had to almost fend for themselves against the world and in their workplace or at their school. I'd like to share a story with you about a very brave client that highlights the paradoxical nature of ADHD. So she's Australasian in her 30s and has a budding career as an entertainer, as a comedian. She's highly intelligent, very quick-witted, and just really warm, loving, and generous. She's married to a supportive husband who also has ADHD, however, remains largely unmanaged, which puts another strain on the relationship altogether. So she was recently diagnosed with ADHD in 2021 and had a history of depression, and then we also identified that layer of complex trauma. So she had been deeply affected by years of emotional deprivation and neglect in her family of origin, a mother who was of Asian descent, who was very loving, but also deceitful, charming, and dismissive of her emotional and developmental needs. She also had a father who was detached and inconsistent with her, so she really didn't have a safe person to go to as a child and was often left to struggle on her own. Prior to her diagnosis, she had tried to study numerous degrees and had taken almost 1 decade to complete a 3-year degree and could never understand why. During our therapy together, she struggled to come to terms with the unresolved impacts of ADHD across her lifespan and the cultural stigma she faces from her mother. So she was rejected by her father's family because she wasn't from a married union between her parents. And so dad being Australian and mum being Filipino, dad's family completely rejected her anyway to begin with. And so it's just very complex and there's lots of layers to her experience, but this is not uncommon in the CALD community. She often felt judged by her weight and has always struggled with weight and cycles of binge eating and restricting. And the battles that she faces daily with the internal self-loathing and overwhelming shame. She fantasizes about the life that she wishes she had and grieves her unreached potential. She'll come in and talk to me about all the other things her peers and friends have achieved: families, marriages, children, careers. And that's all she's ever wanted deep down. But all of those things just feel so far out of reach because she's only been in treatment over the last year or so. She longs to feel socially connected, to be able to have solid friendships that she can rely on in times of need. She craves the willpower to take control of her symptoms, which either make or break her day. She can feel active and comical and engaged in life one day and applauded for all her skills in her field of comedy, but then completely depleted and withdrawn the next, and questioning who she even is and what she's even doing with her life. Despite all of these impacts, she still has the courage to drive, she still has courage and drive, and she attends therapy frequently. She's motivated to change, but also the ADHD neurological component of her experience makes it difficult to apply even the practical strategies that we talk about. And also keeping in mind that there's that devastating legacy of complex trauma in the background that we're trying to work through as well. So I believe that she will recover and build the life that she's always wanted and that she will reach her full potential. The heartbreaking part is that a lot of her pain and suffering could have been avoided through culturally sensitive early intervention. Had her mother known back then, which was impossible, but had she known to look out for these features and to really take her daughter's concerns seriously, she may have had access to that early intervention, and she may not be as stunted as she's feeling now. I'd also like to share another experience from another client who's a young male, and he's in his early 30s. He's incredibly intuitive, intelligent, generous, wise, and considered, and gifted, and he currently consults in the corporate world. And he described being able to easily envision architectural designs off the top of his head as soon as he's presented with an idea. So he's very gifted in that sense. And in trying to better understand his experience, he described feeling that he's always caught between Spock and Captain Kirk from Star Trek. And he feels that in a room full of Spocks, which he calls the logical, rational people, he feels like a Captain Kirk, which is human and flawed and disorganized and has nothing of value to offer. He feels like he's never going to be able to fit in, and vice versa. So when he's in a room full of Captain Kirks, he feels like a Spock. And so he's constantly oscillating between these two conflicting experiences of being a human in the world. And never being able to feel like he belongs or is understood by others, and is constantly caught in this yin-yang scenario where it's impossible for him to fit in and feel heard and understood and taken seriously. He described management's futile attempts to pigeonhole him or leave him to his own devices, both of which leaves him equally lost and adrift in the work that he does. I was struck by his perspective and felt a deep sense of compassion for his life experience. His view beautifully captures the complicated and crippling nature of adult ADHD, and especially when we add all the layers of cultural considerations to these scenarios. So for anyone interested in having an ADHD assessment and diagnosis, whether it's you or someone that you know and care about, there is quite a process to that. So the first step generally is to consult your general practitioner for a referral to an ADHD specialist or psychiatrist or a clinical psychologist. Being mindful, though, that there's really long wait lists, so the earlier that you get in, the better. Sometimes if people are still contemplating whether to get a diagnosis or not, I just encourage them to at least get on a wait list, and then they can always cancel the appointment or change their mind later, but then they're not going through the agonising process of having to wait so long. So clinical psychologists can help to provide a neurological assessment consisting of an interview with the client, a family member, and a number of other assessments and screeners to do a full sweep of their mental health and then to drill down on what is actually going on and what their ADHD profile is so that they can put the right treatment in place. And that helps to identify the person's strengths and weaknesses and to determine the best possible treatment options for the individual. Psychiatrists can also diagnose and provide medication to manage the symptoms, but it's just important to stress the difference between psychology diagnoses and psychiatry diagnoses. Generally, psychiatrists will go through set criteria and give you the diagnosis and give you some medication to trial. And this can often be quite alienating to people because they think that they're going to have someone who really sits down to understand their full experience, but they don't tend to do a lot of talk therapy in their assessments, as opposed to clinical psychologists who will really go through a comprehensive history in the assessment phase, and then they will offer you ongoing talk therapy with a psychologist specifically, but that is more through the element of talking rather than medication. So it's really important to have this kind of multimodal approach to their care. And there's also the neurobiology of ADHD. So neurons tend to fire sporadically instead of in a synchronized way. And there tend to be two fundamental parts of the brain responsible for ADHD. One of them is the default network, and that's responsible for when we're resting, and that doesn't have to work very hard, generally speaking. Then we have the positive task network, which is responsible for narrowing our focus to help execute tasks. So the neurotypical brain can function optimally as these networks function in opposition, like a seesaw. So you're relaxing at home, your default network knows that that's what's happening, and then you might go to, pay a bill, then you know, okay, I've got to flip into that task mode. The problem with ADHD is these two are in constant opposition. And that's why even when they want to sit down to get their work done, they get that pull to just maybe go to sleep or just to relax or get distracted by other things. So it's really in constant conflict. And so ADHD results in the networks being stimulated simultaneously and creates difficulty for the brain's ability to manage competing demands or tasks, almost like having a symphony without the conductor. All the instruments are there, they have all the notes, but the conductor's fallen asleep, and so the whole orchestra is just a bit of a disaster and not sounding the way it needs to. Or a bit like a band. All the instruments are being played, but there's no melody, there's no lyrics, and it's just a bunch of sounds that aren't producing anything meaningful. And that's a good way to understand the ADHD neurological side of symptoms. So there's many strengths of ADHD. I feel like I've dived into the really difficult nitty-gritty parts of ADHD that can be quite sad and heartbreaking, but there are incredible strengths in the ADHD profile and the people that I meet every day. And often they're able to think outside the box. They're generous, they're empathetic, they can be resilient and brave. They can be incredibly intuitive and considered in the way that they approach things. And often we get some of our global leading scientists, entrepreneurs, artists who have had features of ADHD or struggled with ADHD across their lives. They can be fantastic leaders and innovative and spontaneous. They can also have a very strong sense of justice because they know what it's like to suffer. And so for them, when they see other people suffering, they have a really strong sense to step in and advocate or to correct all the wrongs that have been witnessed along the way, which can serve them in some ways, but also get them into trouble at other times. They also have a strong sense of what's fair or unfair, and they try and communicate that to the people around them. They're also willing to take risks. So generally people might be a bit risk averse, but because they have a higher tolerance, they're able to take on higher risks and maybe do things that neurotypical people wouldn't be willing to do. They can also be calm in a crisis because they have brain waves that are associated with relaxation, and they tend to be the dominant brain waves for ADHD. If there's a crisis, they tend to respond very well and take a very calm and considered approach. So people can find that quite comforting and helpful. There's also the perspective of hyperfocus. So for people who are quite high functioning, hyperfocus allows them to deliver exceptional work for the teams that they're working for. And so that can be a real asset as well. So in terms of treatment options, there's a number of different therapies that are available. Cognitive behavioural therapy tends to help people work through how their thoughts impact how they feel and the behaviours that they engage in, and to really break down what the unhelpful cycles are so they can adopt more helpful beliefs, emotions, and behaviours. There's also neurofeedback, which is really interesting and fascinating, actually, and something that I'd like to learn more about over time. But from what I understand, the neurofeedback process involves scanning someone's brain to identify what the strengths and weaknesses are and where the brain might be underfunctioning. So say there's particular parts of the CEO that's not working well, they're able to really identify what that is, and then the neurofeedback will specifically target that to strengthen those parts of the brain, neurologically speaking. So it takes a whole different approach. And to be honest, I think this is probably a really good option for a lot of people because it really helps to almost restructure the brain to optimize it and to help overcome any of the deficits that they may have experienced before. Generally speaking, people can get quite significant lifelong results after about 30 to 40 half-an-hour sessions of neurofeedback. So it's quite a good investment if people can afford to. But again, it is quite costly, so it's a privilege to be able to access that sort of support. Also, lifestyle modification, so not underestimating the impact of sleep, routine, exercise, keeping socially connected, to family, to friends, having hobbies, and just general well-being and all those specific management strategies. Sometimes for people with ADHD, they again know what they have to do, but they really struggle and need a lot of structure to be able to put that in place day to day. Also, parent and family training. This is more for adolescents and children. So generally when children get diagnosed and they're quite young, rather than putting the child in therapy, they look at putting the parents in therapy to help them develop the resources and skills and strategies that they need to better support their child. And also knowing that, children's brains are really kind of malleable up until the age of 12 in particular. And so again, getting that early intervention is super crucial because if parenting strategies can be amended and harnessed and supported to meet the child's needs, they're much likely to get better outcomes long term. Also, organisational and school-based interventions. So sometimes in schools, they'll give children extra educational support, maybe a learning assistant. They'll keep parents informed with a learning plan and really put scaffolding in place to make sure that the child's got the support they need to get the most out of their education and academic experience. In terms of organisational support, this is a tricky one because a lot of clients are reluctant to tell their workplace about their ADHD. And so this is something that's quite personal for people. Ideally, it would be good if people could speak to their bosses or their workplace about ADHD and the specific support that they need. But unfortunately, this is not always the case. But for the lucky ones who are able to get organisational support, it might mean that they are able to work in a quiet room, or that they have flexible working hours, or that they can fidget in meetings with toys while they talk so they don't get distracted, and all these little strategies that can help them focus throughout the day. There's also ADHD coaching. ADHD coaching is focused really on helping people meet their goals in a more practical way. It's very future focused, and there are quite a lot of good ADHD coaches out there. And then you have peer support workers, and this is quite an invaluable resource. So, for example, at the ADHD WA community, they might have people who have ADHD who run some of the support groups where people can get together and share their experience and share ideas about how they can all cope and get through that together. And I think that's really important because ADHD can leave people feeling quite isolated. And also medication. So, again, that multimodal approach is really important. If we can get the neurons firing, if we can get the conductor back awake at the symphony and getting that music going, it's going to make life a lot easier. Doesn't mean they need to take medication forever, hard to say, but if we can just get those neurons firing and plus get them into some talk therapy, usually those two go really well hand in hand. However, some people are disheartened by the medication process because they feel that, yes, great, I've got a diagnosis, I'm going to get medication and that's going to be my magic pill. And that's really not the case at all. For some people, the minority, they try their first bout of medication and they feel amazing and they can focus and they're able to execute on complex tasks. But for other people, it can take years to really find what we call the sweet spot, which is what medication at what dose and what intervals is going to actually help switch their brain on and get it flowing in the way that they need. So it is quite a different process for everyone who goes through the diagnosis and medication. So I'd like to talk a little bit about the intersection of ADHD, attachment and trauma. Has anyone read Scattered Minds? No? So the author Gabor Mate is a physician who highlights the impact of developmental trauma on the developing mind. And he stresses the link between ADHD and stresses that have been experienced in family dynamics, war, financial stress, displacement, attachment disruptions, racism or neglect, which can undermine the brain's ability to develop optimally, leading to a higher risk of ADHD. So, for example, in his case, he was born in the midst of the Holocaust, and so his mother was very, very stressed at that time, and his father was in one of the camps when he was born, and they had no idea if Dad would be coming back. So, in utero, he was exposed to probably a lot of cortisol, a lot of stress hormones, which would have had neurological implications for his brain development. Then that's been reinforced when he's born through mum's anxiety, as you would be as a mother during the Holocaust, and then subsequent to that, a separation from his mother during infancy. He shows photos of his sort of his detached, sort of really removed way of seeing the world as a child. He's got a photo, when he's 3 or 4, and you can just see he's completely detached and removed. And he really puts that down to the trauma that he experienced early on, and you can really see how that's led to his onset of ADHD. But he's looked at this all in hindsight. And so we can see how much that compromises us neurologically when we are exposed to these things. And if we look at the CALD community, there often are these background traumas that are happening for women and children in utero or after birth, and all of the separations and visa issues that families can go through. So this is a big factor to keep in mind, that it's rarely ever just ADHD. It's often met with a whole undertone of layers of trauma. He also suggests that healing from ADHD is possible with integrated and a more holistic approach. And this can include self-parenting techniques, processing and integrating developmental trauma, and improving your relationship with yourself. And I have to agree with his approach because what I often see is people are coming in, and yes, I can give them a whole bunch of CBT strategies, which can be useful in the short term, but have they really done the work to develop a positive, nurturing relationship with themselves? Have they developed that cohesive narrative that makes sense to them? Have they really looked at their attachment wounds and how that's impacted the way they feel in the world? And really, I feel like until we get to that underlying stuff, the more short-term treatment is more like a Band-Aid. And yes, it can work in the short term, but will it really help them in the long term? We don't want them coming back in for therapy. We want them to recover in such a way that's holistic, where they can just move on with their lives. So it's something, again, to keep in mind. Some of the recommendations that he has for people with ADHD and their recovery is developing that self-compassion and a curious approach to developing self-insight. So for a lot of ADHD people, they can be quite self-punishing because they've been through so much, they've lost so much when they get that adulthood diagnosis, that they just sort of look around and think, I'm a waste, I have nothing of value to offer, and there's so much self-criticism. And so it's really starting to undo a lot of that, and being able to self-accept and accept that the past is the past, but they can determine how their future looks. And also being able to tolerate the anxiety and guilt, because they've had to almost walk on eggshells their whole life with the ADHD. It can be quite a shift to move away from that anxious way of being in the world. And often they can feel guilty around letting people down because they're so desperate for social connection that they can often self-sacrifice and subjugate their own needs to stay connected to other people, which perpetuates their symptoms and makes them more stressed. So also things like sleep hygiene, nutrition, nature, extracurricular activities, recreation and creative expression were recommended by him, and meditation and mindfulness. Again, nothing new, but we really have to consider all of these factors in people's treatment and support. He also made an interesting note around recreational time because obviously we live in a technology-driven world, and so for a lot of people, recreational time, especially young people, could include binge watching Netflix or scrolling. But I think it's important that we make that distinction. He did explain that the original term for recreation is to recreate yourself, which I had no idea about. And so what we're looking at is, okay, when you get off the couch after binge watching that Netflix, do you actually feel like you've recreated yourself, or do you just feel the same? And I think that's a really important distinction for people to make, as opposed to getting out in nature or doing some art or dancing or doing something that's truly, soul nourishing. So I'd like to talk a little bit about the cultural considerations for ADHD. There tends to be a limited amount of culturally sensitive ADHD specialty resources or centre. I have to say, even going into the ADHD centre I went into, it was a lot even for me and, my family, but I can't imagine for people in the CALD community who might speak a different language, who feel quite different to the people even working there, because it tends to be, run by Caucasian people, highly educated, and so already there's that kind of power difference, and they might not feel comfortable going into those environments. Also, the persistent misconception that ADHD does not exist. I've had a lot of clients who are struggling, and we've done the ADHD screener, and they look like they meet the criteria for ADHD. They go home, they say, "Hey, mum and dad, I think I've got ADHD. Can you please help me fund the process of getting diagnosed?" And mum and dad, say they're from the Middle East, will say, "Absolutely not. That just doesn't exist. It might be a white person's disorder, or it just doesn't exist. You're just lazy. You just need to get yourself together." And this is someone who's already struggled their way through the whole schooling system, who's now about to start uni. And so if she doesn't get that early intervention, we know what's going to happen. She's probably going to keep failing. She's probably going to switch from course to course. She's probably going to struggle to actually graduate. And so these are really important considerations, is how can we start to communicate to the CALD community in a way that helps them understand that this is a real disorder, that it has real ramifications, and that there's nothing to be ashamed about in terms of getting help. Also, cultural differences in the attitudes and interpretations of ADHD need to be understood. So, asking people in the CALD community what it means for them to know about ADHD, how do they understand it, and trying to bridge that gap, because we really don't know. It could mean many different things in many different cultures. Also, the lack of culturally considerate awareness programs to help better support marginalised communities. The new ADHD guidelines that were released did not have a specific consideration for the CALD community, which I was really struck by, since we live in such a multicultural society. I know they've worked very hard, and I know it's a starting point, but they did have subgroups for Aboriginal and Torres Strait Islanders, but there was nothing to speak outside of cultures outside of that area. So I think that's another important part. Also, ADHD can induce an overwhelming sense of shame in the CALD community and their families. Sometimes it can be interpreted as being defective, like they've raised their child in the wrong way, and that's why they have ADHD. And so it's actually mum and dad's overwhelming shame that stops them from getting their children help, or even their own help. Also, some other barriers to keep in mind is how ADHD can be often overlooked or misunderstood or mislabeled, and the different perspectives that people attach to ADHD, but that isn't ADHD. I remember growing up and having a cousin who seemed really ADHD. He'd be crawling up the walls all the time. And my mum would know, oh, well, I think he has ADHD, but would his mother, who was Indonesian, pick up on that and actually get him support? No, because she was busy raising 4 children. She was busy in a parenting role. Her husband was busy out working. Not that they were in survival mode, but they didn't really have the space to even consider what that might mean or how they can even get help. And they probably couldn't even afford the help anyway. And that wasn't that long ago. So these are all the things that we need to keep in mind. Also, the CALD community might not have access to transport or a support person, and ADHD resources may not be available in their language. I remember when I was working at the Women's Health and Family Services, we had to help make sure women could get to the service. And that might mean organising a friend to come with them, or making sure they knew how to get there via bus or train. And I don't think a lot of those structures are in place in the private space. And that's a concern and a definite barrier. And also having a support person. People might have people in their lives that they want to bring in, but will that person be supportive, or will they be dismissive of their whole experience? And as I mentioned before, particularly CALD women, we have to be aware of the roles that they may have taken on in terms of their marriage and parenting or community obligations. It doesn't often leave much space for them to even care for themselves as an adult, because they're busy caring for other people, which is reasonable. But how can we get in to make it easier? Is it having ADHD kind of interventions and assessment clinics at the GP? So when they take their children for injections or usual checkups, they can also get themselves some support and have that easier access point, rather than having to go to a specialist centre that is out of reach. There is a risk as well that CALD people may experience further judgment and rejection from their family or community if they seek support. So again, they may get the diagnosis, but that doesn't necessarily mean it's going to be accepted, and they may in fact be shunned from their families of origin, which we don't want. So these are other bridges that we have to consider. It's also considering that CALD women may not always have the same opportunities and resources as men, leaving them at high risk of suffering from undiagnosed ADHD and the implications that can have for their children. If we have, say, for example, mum struggling with ADHD and snapping at her children and getting frustrated and overwhelmed day to day, we can see how that can have an intergenerational negative effect. So we really need to find ways to better support these communities. It also may be helpful to have practitioners from different cultures and backgrounds. Again, I was really struck when I was at the ADHD launch at Council House, because most of the people in the room were Caucasian, highly educated, and I just thought, even for me as a non-white person, it was quite intimidating. And I thought, well, I can't imagine if I was from a completely different culture, how that would be. I don't know if I would go, to be honest, because you just don't feel very welcome. And so I think it's really important that we make sure that there's people trained in this area from all different backgrounds, from all different cultures, who are able to speak that language with that person or consider that exact cultural consideration that they're experiencing. An example of this is that clinical rates tend to be lower in African American and Latino populations compared to the Caucasian population in the US. Again, it's a different country, but I think the statistics may also extend and be similar to what we may see here in Australia. So I think it would be good if Layla and I could maybe, advocate in this space for making sure that the CALD community has guidelines that are specific for them. Because again, if we miss that, we're just going to perpetuate that cycle of them not getting the help that they need. Now looking at the barriers to ADHD diagnosis and treatment, there is no current NDIS or Medicare rebates for ADHD assessments. So yeah, I was able to take my son for an assessment, but that's because I'm a health professional and I have a decent income and I have access to a supportive family who are willing to be open to that and to come with me to the appointment. And so those are all privileges that not everyone has. And really, when we look at ADHD, it is a disability. And so why is it not under the NDIS program? If we had that, it would make support a lot more accessible for people, and also carers. If you've got a child with ADHD, parenting is a lot more exhausting, it's a lot more difficult, it's a lot more taxing. And so parents do need respite, especially single mothers or women in the CALD community who may not have much community support. So these are all factors that we have to consider. Also, Medicare rebates, at least for ADHD assessments. The current diagnoses and treatment options are expensive, which limits accessibility to marginalised communities. And generally, assessments can cost anywhere, and this is very conservative, anywhere between $1,000 to $3,000, and that is not including medication. So you're sitting there and you're thinking, okay, I've been through this horrible experience of not having proper treatment, and now that I do, I've got to fork out all this money and hope that I do have the money to afford proper treatment from there. And you can see how people would drop out of therapy, because if they've been able to afford assessment, doesn't necessarily mean they're going to be able to afford the ongoing treatment. And then that creates another issue in itself. Also, families denying the possibility and impacts of ADHD on adults, and parents and the CALD community, adults being unable to afford diagnoses and treatment. I mean, we're living in a time where we've just been through a pandemic where families are really struggling just to pay basic bills, and then we're going to suggest to them to go and spend thousands of dollars to get a I mean, it's just completely unreasonable and unattainable for many families. And that's, something that we need to work on as a community, is to make sure that there are easier ways that they can access it, whether it's through an NGO or government-funded program where people can access this at either low cost or no cost at all. Also, being aware of the barriers, even for a lot of young adults, is even if they go to places like university or they do get that career, it doesn't necessarily mean that they're going to be able to get the correct support in those environments to reach their full potential. Often I have clients who, we're in the middle of therapy, we might be doing a bit of trauma processing, or they're really struggling with their ADHD symptoms, they've missed a whole bunch of deadlines, they're on the verge of failing that term or that year. And, they've got to write and they've got to justify and they've got to explain and they've got to get a letter from me. And that's so many barriers for someone who's already under so much distress. And so we need to have almost like an inbuilt system that easily flags people with ADHD to allow them to have these special considerations before they even start their programs or start their careers. So I'd like to move on to some options to minimize the barriers. So I think it's important, I know that for the ADHD guidelines, they have consulted with consumers to help inform and make the guidelines meet the needs of people in the community. However, I'm not sure if they've actually consulted with the COLD community itself to better understand the difficulties that they're facing in terms of adequate support and diagnoses and treatment, and what those barriers actually look like for them. Also considering a holistic approach to help minimise being dismissed in their families. So yes, we might talk to a young adult about getting help, but if mum and dad don't approve, they're not going to be able to get the support that they need. So it's really getting mum and dad on board, or the family on board, and making sure that they are well supported outside of the treatment or diagnosis process. Also providing culturally sensitive ADHD-specific training to health professionals. I've also often had feedback from clients who have felt judged and misunderstood and dismissed, even unheard and unseen when they try and express the cultural or religious impacts on their ADHD or mental health. Often it's just completely shut down and overlooked by a doctor who's Caucasian or a psychiatrist who's Caucasian who comes from a privileged background, because they're not really willing to even consider what that means for that person. And that can actually be re-traumatizing in itself for them. I think it's also important that, we've got the NDIS hopefully in the future and Medicare rebates, and also the bulk billing option for vulnerable families. Because even with Medicare rebates, say the assessment's $1,500, say you have a rebate of $500, that's still $1,000 out of pocket. So we need to consider those implications. We also need to normalise the prevalence of ADHD in the community to assist in reducing stigma and shame associated with the disorder. It would also be helpful to have interpreters at these services or centres so that the COLD community can speak in their own language and feel more comfortable and secure in the process. So the COLD community considerations and approaches need to be included in the evidence-based ADHD guidelines to minimise barriers to treatment and increase the accessibility to high-quality care. Just because someone's from a different culture or background or socioeconomic level doesn't mean that they should be disqualified from accessing proper support and treatment. So some of the benefits to getting proper diagnoses and treatment means that they can have an improved sense of focus, they can enjoy solitude and reach their full potential. They may be able to have better interpersonal and social effectiveness, which is often a struggle for them before they have proper treatment. They can have improved self-esteem and sense of agency and really take their power back. With ADHD, because they're on the receiving end of so much criticism, it's so important that they're given the resources to take their power back, to dictate their reality, to better understand their needs, and to really assert that in the community and to the people around them. Also mental clarity and improved executive functioning. Medication can significantly reduce symptoms and improve overall well-being, but that's not always the case. Sometimes it takes holistic care to make that happen. and also the reduction of negative impacts across their life domains and also the next generation to come. I have a lot of clients who are in their 30s who really want to start a family, but they're really reluctant and often put children on the back burner because they are too fearful that they're going to hand it down to their children or that they do not have the resources and means to be a good parent. And so they may, they have a time limit. They can't have children in their 50s, and so it's looking at how we can better support them around those life transitions. So here are some ADHD resources. If anyone's interested in finding specialist psychiatrists, paediatricians, coaches, psychologists, there is a directory at ADHD WA. If you don't find what you're looking for on there, you're welcome to call them, and I think they have a larger directory on their end. There's also the ADHD Professionals Association for anyone working in the area. And two books that I would recommend as a good starting point to really better understand ADHD is ADHD 2.0 and Scattered Minds. Scattered Minds is probably one of the best books that I've read in terms of really understanding the implications of trauma and ADHD in our community, which again, hasn't even been on the radar. I mean, ADHD hasn't been on the radar, but trauma and ADHD has just been, off on Mars, and we need to get it onto Earth and really getting it into our everyday lives and practice because there are huge implications that come with that. So feel free to contact me. I have my details here, so you can scan it and you're welcome to call or email if you have any more questions or you'd like any more information. I hope that you have found today helpful. I know that it's a bit of a paradox looking into ADHD because it sounds like all doom and gloom, but the good news is that hopefully in time we will get better options for people to access more care, particularly in the COLD community. So I hope you found it helpful. I hope you found it informative, and thank you for having me today. Can I just add a few more things, sorry, before we move on? I hope that one day no child or adult will ever have to suffer in silence with the impacts of ADHD, and that it will become easier to screen and provide early interventions that minimise the impacts on the trajectory and quality of lives it touches, and to ensure that the next generation is able to reach their full potential through more accessible and culturally sensitive ADHD support options. I think that's just something important that I'd like for everyone to hold in mind and take away from today. Thank you.
So just a reminder that we will have a chance to ask Jamiela a couple more questions during our Q&A. So just get that prepared in the back of your head. So our next speaker is Laila El-Hafiz, who will be sharing her lived experience with ADHD and being diagnosed in her adult life. Laila is a small business owner and is currently executive assistant to the CEO and executive team at Ishar. Laila will detail her lived experiences with ADHD and share the cultural, social, and environmental factors which she was presented with before diagnosis, during the process of pursuing a diagnosis, and in the aftermath. So if you would like to join me in welcoming Laila to the podium.
Hello, everyone. Thank you so much, Jamiela, for presenting. I am severely ADHD, so I will start by saying that I might fidget, I might talk really fast. Parts of my presentation are written out in scripts because there was a few things that was really important to me to include today. But for other parts of it, I'm probably going to freestyle, so please do bear with me. Stick this guy in here. Can everyone hear? Awesome. So I'd like to begin today by acknowledging the traditional owners of the land on which we meet today and pay my respects to their elders past, present and emerging. So I want to start by doing a little bit of an interactive activity, just because some of the content that I'm going to discuss is a little bit heavy. I'd like to include a trigger warning for today, because I will be discussing some themes that might be a little bit difficult. So I had about 3 months to prepare my presentation today. So I'm going to give 3 options, and I want you to raise your hand on where your vote is cast. So if you think that I prepared this presentation about a month ago, please raise your hand. Or if I started a month ago. No one? Okay. How about if I started preparing this a week ago, please raise your hand. Okay, we've got a few. And the last option is if you think I started this 15 hours ago, please raise your hand. So the last one is exactly what happened. I've been really excited to host these seminars. So Let's Talk Culture is one of the projects that I work on. I was so excited for this year because I wanted to do the Neurodisability series, but of course, every time I sat down to try to work on it, I couldn't. So, okay, so I'll start talking about who I am, just to give a little bit of context to my background. So my name is Layla. I'm 32 years old. I'm a daughter of migrants, so I'm Egyptian in heritage, and I migrated here with my family when I was 1 year old. So I have 2 older sisters, a mum and a dad, thankfully. So when we moved to Australia, we came here on a business visa. This ties into the story later on, so bear with me. My sisters and my mum and my dad did not speak a word of English when we came here. We had no family here, no friends, nothing. We literally came here, started from scratch. I grew up between Perth and Cairo, so I was really lucky that my family had the means that we were able to travel to visit our family every single year. So it was a really big juxtaposition between the 2 cultures, and I'm going to be discussing the intersection of how my ADHD diagnosis and my cultural background kind of intersected. So what do I do for a job? So as Jamiela mentioned, I work at Ishar 4 days a week, and I support Ishar's board, the CEO and the executive team in the strategic planning of all the things that we do. I also am a business owner, so I own an event staffing business. I also do consulting. So the types of events that I specialise in are music festivals, which are large scale. So my niche is festivals around the size of 5,000 to 30,000 people, and I provide staffing for all the client-facing components of that. So sometimes I'll have a team of 10. I think the biggest team I've ever managed was a team of 120. So that's me. So I've broken up my presentation into 3 sections because I think the context really, really matters. We've got the early years, my adolescence, my adulthood, and then I will talk about post-diagnosis, which happened when I was 26. So I created these 2 diagrams to basically paint a picture of what my life was like before. If your eyesight is bad, this is a circle that says a cul-de-sac of broken dreams, unpaid bills and other chaotic stuff. And this is a dumpster that's on fire because my life was a dumpster fire, well and truly. Okay, so my early years. Some things that I really wanted to highlight about my early years. As I said, I grew up in a household where I had a completely different experience to the rest of my family. My parents left their family and their friends and came to a place where they had no friends, no ability to communicate, very limited language, no resources available because we came here on a business visa. So I had a very, very different experience to my family at home because, I didn't really have that trauma of separating from the family as much. I didn't have as much of an emotional connection, and I was learning to speak Arabic and English at the same time. So there was a little bit of a disconnect at home. I remember the first time I ever heard the term ADHD, and this is etched in my memory. I will never forget it. So I was at after school care, and there was a little boy who was clearly struggling to emotionally regulate. He was hyperactive, he was aggressive, and he was being treated very much like a problem. I didn't know what ADHD was, but at the time, and honestly, throughout my entire schooling life, it was very much used as a derogatory term. I never saw any female students being referred to as ADHD. It was always the little boy that was slightly psychotic, licking the walls and giving everybody grief. You know, none of the teachers or the carers had much empathy, and no one really wanted to hang out with him. So I just remember that as a very, very clear memory. I had some pretty intense learning differences. So I was really, really slow to, I guess my development was slower than my peers. So I actually repeated pre-primary. I was held back in school. I think I struggled switching between two different languages. So I would be at school, say, like talking to my friends, and then I would start talking in Arabic and not realise that I was speaking to them in a different language. So that was pretty funny. At my school, I was one of two Muslim girls at my school, so it's worth noting for context that my parents, of course, Arabic Muslim parents, sent me to an all-private girls' school. There is no private Muslim school. They would have sent me there if that was the option. But I went to an Anglican girls' school. So I was one of two Muslim girls at this school, and the other Muslim girl was in my year, but she was from Malaysia and she was a literal princess. She was a member of the Malaysian royal family, so we didn't exactly have that much in common. But yeah, I just remember it was very strange. It was a different time. You know, there weren't any other Muslims in the school, and I really, like, another memory that really stands out to me, I was in year 1 and we were making food as a part of I think it was like a class or a fair or something, and my year 1 teacher separated me from the rest of the group. So Kathira wasn't there, my other Muslim friend wasn't there. She separated me from the rest of the class and was acting like I was going to burst into flames if I touched the pork that they were using. Like, it was the funniest thing to me. I always had a big sense of humour about things, but I actually got in trouble because I said to her, you know, I'm not allergic to it. Like, nothing's going to happen if I physically come into contact with the pork. And she thought that was incredibly rude. So I was sent to the principal's office. When I was around 9 years old, I think this is when I started to experience hyperfocus and hyperfixating for the first time. So I discovered the Harry Potter books, and I was obsessed. I used to fake sickies and stay home, and at the time I didn't realise that this was strange, but this was probably a sign that I was a little bit ADD, because I would read the books cover to cover. I wouldn't drink any water. I wouldn't eat any food. I wouldn't sleep. I would just wait for the book to be released and then read it cover to cover in a day. I grew up during the 9/11 era, which was very, very, very hard time for anyone that comes from an Arabic and Muslim background. So at the time, there was a lot of fear in the community, and, you know, you would turn on the news, breakfast, lunch, dinner, all the talk was about Islamic jihadism and Islamic terrorists and, you know, how Arabs were dangerous, essentially. And I've never spoken about this openly because at the time, I think I had a lot going on in my life. Obviously, my parents were adjusting, I was behind all my peers. And yeah, we experienced a lot of racism, and that went on for 10, 20 years. So a lot of people were very prejudiced and were very horrible to me and my family. I remember, distinctly remember labourers coming to our house and seeing the Quran on the table and refusing to provide services to us. So it was a really complex time. I remember receiving report cards was the absolute worst time. I hated receiving the report cards because they always said the same things. I was slow, wasn't focused, I was distracted, I lacked discipline, I had a hard time, I never did my homework, I never listened, but one theme that was consistent was that I was either the teacher's favourite or teachers hated me. And that was just true forever. So, yeah, that was the early segment. So, adolescence, I stayed at the same school, I was still private schooled. So, for context, private schooling in Western Australia is very, very competitive in terms of their scoring. So at the beginning of each year, we did academic testing, and that was a way basically to lump us all into groups based on our intelligence. And I tested very, very highly. I tested in the higher percentile for my year group. So I was put into very, very advanced classes. And I would always start off acing absolutely everything. And then towards, 3 weeks in, when I lost, my dopamine receptors started to slow down a bit, I would start to fail at the subjects that I didn't like. So I, failed at maths and science, and my teachers hated me, but all the humanitarian subjects, I was top of my grade. I almost got expelled from year 12, actually. I almost got expelled from school, which was horrifying because I thought, oh my God, my parents have sent me to this expensive school for, 13, 14 years, and I'm going to get expelled because my grades were so bad. So the school that I attended is considered to be very prestigious, and they didn't offer me any help. They just said, if your grades do not improve, we're going to expel you. That was it. There was never a point where there was any intervention from my teachers, nothing at all. I had no idea that I had ADHD. So adulthood is when I think my executive dysfunction really became evident because I didn't have that structure around schooling and assessments and things. I had no one to send me off to detention if I didn't do my homework. So the Harry Potter fixation continued. But lots of other really, really bad things happened in this time. So I distinctly remember when I started university, university was an hour away from my house, and I would get all the way to uni and I would literally get to the door of my class and sit outside and just cry because I physically could not go inside. I couldn't go in. I was so bored. I hated it. Again, I'd start off really, really well with good intentions, and then everything would crash and burn. I got into a cycle of everything was falling around me. Everything just felt like it was crashing and burning. So I was getting fired from jobs. I was accumulating a ridiculous amount of debt because I couldn't control my impulses and my spending. I went through this period where I kept forgetting to pay my driver's license and my registration, and I kept losing my license. So I'd forget to pay my rego. I'd get pulled over by the police. My car would get impounded. Then I would forget to pay that, and it just went into a massive cycle. And I just remembered at this time feeling like I'm never going to get my life together. I'm going to end up on the street. I'm going to end up homeless. No one's ever going to give me a job. It was really, really hard. And because so many things were failing in my life, it manifested into really low self-esteem. So I had really, really toxic relationships, abusive, romantic relationships. The bar was on the floor. The bar was on the floor because I thought I'm not anything special. So anyone that will be friends with me, anyone that will take me, anyone that will be with me, that's so great because that's the best that I can do. I didn't realise this, but I used to get really, really, really anxious and depressed on my way to work and uni every day because I was in traffic in my car or on the train. And now looking back at that, it makes total sense because I had sensory issues and I didn't like feeling suffocated inside an enclosed space. So that one's interesting. At this time, because everything was spiraling out of control, I kind of adopted so many different personas. So I've got my gypsy era. I've got, the whitewashing, the party girl phase. I just really wanted to fit in. I always felt like I didn't fit in anywhere. I didn't fit in with my family. I didn't fit in at school. I didn't fit in at uni. So I just shape-shifted and adopted so many different personas. I even adopted a gypsy era where I was like, okay, I'm just going to, save money, work, travel, study. And that was what I did. I just kept adopting different personas, trying to figure out who I was. And I fell into pretty deep bouts of depression. There was a lot of suicide ideation, body dysmorphia, eating disorders, all the hard things in life. So I went to Europe by myself. And this is actually the start of when everything changed. So I was having a discussion on the beach in Barcelona with someone that I'd met and he was a doctor, and I was just emotionally unloading on this person, talking about how my life is spiraling out of control. And he said, it really sounds like you've got ADHD. And I still thought that ADHD was that kid licking the walls. I'd never, ever heard of a female having ADHD. I never understood what it actually meant. So that kind of was the beginning of my journey. And I was 26 years old when that happened. So this is a photo of the waiting room chair. And I've written this down because it was super important that I share this part. So I finally decided to look into seeing a specialist about my ADHD. The waiting room chair on the day of my appointment is etched into my memory and will be for the rest of my days. I spent a lifetime feeling out of step, invisible, stupid, slow, and to be frank, like a total failure. I had panic attacks all the time. I just felt very alone. So upon sitting in that chair, reality really set in for me, and I just felt incredibly vulnerable and exposed. Because if I was diagnosed with ADHD, then my whole life would make a lot of sense. There would be a reason, an explanation. There was hope. There was possibility for change. I'd spent my entire life watching everyone around me progress and move forward, and I felt like I was going backwards and just ruining everything for myself. So I thought it was because I was different. I came from a different family. I couldn't quite figure it out. But what if that wasn't it? But then the real moment of vulnerability kicked in, and I thought, what if I came all the way here and I spent all this money and I've gone through all this effort and the doctor says you don't have ADHD? What if I don't? What if I am just what if I am just a failure? What if I just lack discipline? And I was exactly the person that everyone had been telling me I was for the whole time. So it was really scary. I remember the colour on the walls. I remember the way that the clock looked. I just remember sitting there and feeling like everything was just in front of me. I think I really saw myself for the first time when I was sitting in the chair. I saw my deepest fears and I realised my own truth. Thankfully, when I walked in, I explained my symptoms to the psychiatrist and he said, if there was such thing as a queen of ADHD, it sounds like you're it. So I was very, very relieved, very relieved. So on this screen here, I've got, the timeline and the associated costs with my personal process. So there's a number of reasons why I wanted to include this. Just to go through the irony of the fact that people with ADHD struggle to make appointments, struggle to commit to things, can't remember to do anything, and there's so many steps, so many appointments. Step one, comprehension, lots of mental breakdowns. It took me about 6 months to actually decide, okay, I'm going to do it because I was really scared. Step two, I went to get a GP referral and I saw 3 GPs before someone would give me a referral because so many of the GPs were saying, no, you don't have ADHD, look at you, you're fine. Or girls don't get ADHD, it's something that's diagnosed in boys, you grow out of it, look at you, you're so normal, you don't have ADHD. I got the referral on the 4th go. So the cost of that was $150 and that's a partial Medicare rebate. The initial psychiatric assessment, the cost was $950 $50, and I got a partial Medicare rebate of $260. So there was a 3-month wait list. It wasn't too long. And it's worth noting that every psychiatrist is different. So my psychiatrist had a discussion with me. He gave me some medication to try. We had a conversation. He sent me on my way and said, come back in a month. Other psychiatrists go through many, many, many appointments before they're prepared to give out a diagnosis. It's also worth noting that at this time, there was so much commentary around dexamphetamine, which is a medication that is prescribed to people with ADHD, and that medication, that magic little pill, saved my life. But it was like a gutter drug, it was a party drug. There was so much stigma, even around the medication that we take, which is crazy. So step 4 was ongoing psychiatric consultation. So at first, I had to attend appointments once a month, and the cost was $260 per appointment. Then after 6 months, it went down to 3 months, and now I see my psychiatrist twice a year for my medication. Bonus, step 5, therapy, which I highly recommend. My psychiatrist basically said this is something that you should do, and I definitely think it's something that everyone should do. So it was $260 per appointment with a partial Medicare rebate. So my life after diagnosis looked very, very different. I just want to be really honest about some things. There was a lot of grief and there was a lot of resentment, I just couldn't stop thinking about where I would be if I had known. And something that really struck me was when Jamiela was talking about the cultural differences. So I ran home after my appointment and I was so excited to tell my mum, Mum, I've got ADHD, I've got an answer to all my problems, because, my sisters were really gifted. I was a problem in my household. I was troubled. I cost a lot of money in tutoring fees. My poor mum, I did her head in, and I was so excited to tell her. And she said, oh, yeah, I know, your teachers wanted you to get diagnosed, but I just don't believe in that. And that was the first time I had ever heard of that. So that caused a huge rift between us. I was so resentful. I was so angry. And she didn't want me taking dexamphetamines. She's a pharmacist. She didn't want me taking amphetamines. So there was that cultural barrier. It is worth mentioning that she is on board now. We're all good. It took a lot of healing and educating, but Jamiela spoke about it perfectly. That was exactly my experience. I spent about a year figuring out my medication dosage. So the experience of a lot of people with ADHD is so similar, where you go to your appointments and then your psychiatrist goes, okay, here are your amphetamines. Just try to figure out your dosage. And that is the most vague sentence. It is the most vague sentence. It took me years to figure out my dosage. So there are massive changes to your appetite when you start taking these medications. So obviously I had a history of body dysmorphia and, the tendency to lean towards more eating disorder type behaviour. So my body weight dropped drastically at this time. I think I lost about 12 kilos because I was thriving. The dexamphetamines worked for me so well. I was able to, start paying off my debts. I didn't have a late bill ever again. I haven't had a speeding fine or anything to do with my license happen ever again. It was really magical what the medication did, but figuring out the dosage took me a very long time. And to be honest, I'm constantly having to change it still now to this day. So I started my first business as well. So yeah, it was overall a really, really positive experience. But I guess it's worth noting that this was the first phase in rediscovering life. It was very surface level. So the most notable thing to mention for me here is that something I always say to people is that before my diagnosis and before taking medication, I always felt like who I was on the inside was never reflected in who I was on the outside. I knew I was smart, but I couldn't string a sentence together. I knew I was funny, but I always messed up the punchline. I had great ideas, which I could never follow through on. I knew I was different, and I tried so hard to be like everyone else, and I just couldn't be. So diagnosis, medical intervention, and medication ended that cycle for me. And I finally began to feel like who I was on the inside and who I am on the outside were cohesive and the same. So everything felt so off, and it finally just felt like I could be me, which was really great. So, life after diagnosis. So this is part 2. And I wanted to share this experience because this really was a huge turning point for me. So the handsome man that you see on the screen is my good friend Toby Lord. So my friend Toby and I met when we were 20 years old, and he was a very close friend of mine. After I was diagnosed, I learned that Toby also had ADHD, and it made perfect sense that we had such a strong connection. We would stay up till 6 a.m, just talking nonsense, hyper-focusing on each other. And we really shared a lot of the same energy. I saw so much of myself in him. We were very much like mirrors to one another. What we experienced in the world was very similar. I feel like he was always either at the top of his game, thriving, absolutely killing it, crushing it, the most charismatic person in the room, or he was really, really, really struggling. And I experienced the same of that. I feel like I'm either the best at what I'm doing or I can't get out of bed. So we shared that experience, and we both thought that having ADHD meant that we were just naughty and we couldn't focus and that we were larger than life. That was something that we bonded upon. So the reason I'm sharing this is because on the 16th of August in 2020, I'm going to try and race through this part because I don't want to cry, I received the worst phone call that you could ever receive in your life. So my friend, unfortunately, took his life. And, it was such a shock to me because I knew that he was struggling, but I never, ever anticipated that that was something that was going to happen. He was so bright. He was larger than life. He was the most alive person that I have ever met in my life. And it was a wake-up call because I saw so much of myself in him, and the context in which he chose to end his life. I've been in similar circumstances before, and I really wanted to gain a deeper understanding of what he was going through. And, I thought intuitively maybe there's just a bit more to it than I thought because, as I said, I'd never really heard anything about ADHD. Even with all the medical appointments, the psychiatrist, all of that, I'd never heard anything beyond the symptoms. So, upon deep diving, I learnt a lot from reading books, listening to podcasts, just doing my own independent research. So this list of things here, so depression, anxiety, job loss, infidelity, to be clear, this is being the person who cheats in a relationship, substance abuse, addiction, self-harm, suicide, corresponding neurodisabilities, complex PTSD, eating disorders, homelessness, criminal activity, financial hardship, gambling addiction, personality disorders, trouble maintaining relationships, and unplanned pregnancy. You are more likely to experience all of these things if you have ADHD. Statistically, the odds are stacked against you. A lot of the time, people experiencing ADHD will experience more than one of these things at a time. I thought that this diagram was such a great representation of what it means to have ADHD. Just by looking at it, it's intense. There is a lot going on all the time. There's a lot of good and there's a lot of confusion. There's a lot of chaos. And that really is a perfect representation of what it feels like to have ADHD that's unmanaged and not under control. And even when it is under control, everyone has their days where they feel overwhelmed. I know I certainly do. So it's been pretty gloom and doom up until this point. So I'm going to start to lighten it up now. It's going to start to get fun. So the positives about having ADHD is that people with ADHD are most likely have a high IQ. They're very resilient. They're far more likely to start a business. They're very creative. They have a high attention to detail because all of us have kind of compartmentalised and internalised this idea that we're not organised. So it's like a good trauma response. I love mine. Empathetic, emotionally intelligent, passionate, high-performing, thrive in chaos. When I tell you the world could be burning around me and we could be walking through Armageddon and I will not even flinch. I'll be cracking jokes, like figuring it out. It's all good. No worries. And yeah, if they are doing what they love, they'll be masters of their craft and masters of the universe. That's just my personal opinion. So this is a list of some problems that I have associated with my ADHD, and I call them my forever ADHD problems because there's just not always a solution. It's not something that I can help. These are things that have consistently popped up and it really annoys me. And yeah, my laundry, I'm always late, but thankfully I have very, very supportive colleagues and wonderful friends that understand that it's not personal. Imposter syndrome, body dysmorphia. I forget to eat and drink. I hyper-focus at work. So if I work from home, I will sit on my laptop and literally not come up for air for 6 hours. And then I kind of am like, I feel kind of weird. And I'm like, that's right, you haven't had a sip of water or a bite of food. So that's just something that is a constant for me. Sensory issues, ADHD paralysis is something where you have a lot to do and you become so overwhelmed that your brain goes, it's okay, you can just take a nap, and it's almost like you become a part of the furniture. So I struggle with ADHD paralysis. It's mostly to do with tasks for me that I don't want to do. It's never for anything that I enjoy, but it's always just going to the post office, getting a blood test. I have blood test sheets in my car that are basically like a part of the boot at this point because they've been sitting in there for so long. I am completely not functional without my medication. So sometimes I'll try to just have a bit of fun and not have my medicine for a laugh, and it's so bad. I will put milk in the oven, I'll put sugar in the fridge, not at all functional, and I'm sleepy all day. Hyper-focused induced burnout. So I'm very fortunate to work in 2 careers that I absolutely love and that I'm passionate about, but I'm constantly doing the most at all times. Insomnia, I have been medicated for my insomnia for, I would say, the last 20 years. I don't remember a time when I put my head on the pillow and fell asleep naturally. It's just not something I'm capable of doing. So here are some of my superpowers. I'm not going to go through all of them because it's a bit awkward to, rant and rave about yourself, but these are my strengths. And I think that I've really learnt to, optimize my strengths and work to my strengths, and that took a really long time. It took a lot of failed jobs. It took a lot of, failed ideas, and I've realised what works for me. So, yeah, I'm just, I feel like I've figured out who I am at this point, and these are the strong points of my personality. So, is there anyone here that has ADHD or is related to someone with ADHD? Yeah, okay. So this is a list of things not to say to someone that has ADHD. Anyone with ADHD has heard this, has heard something on here or all of these things so many times. When people say to me, like, have you tried writing a list or have you tried setting an alarm? I just want to scream. Like, I literally just want to say, thank you so much for that amazing idea. You just cured my neurodisability. Thank you. Congratulations on being a genius. Do not say these things to people because it is not helpful, and we hear it over and over and over again, and it is so annoying and so insensitive. Some helpful antidotes. So I think these things are really important. So we had a disability training at Ishar recently, and the person presenting the training said you need to throw away the idea that everyone is created equal because they aren't. And I'd never heard anyone say it like that. And it's so true because without equity, equality is a myth. It's a fallacy. We're not all created the same. Yes, I have a neurodisability, but I am able-bodied, which means that I'm not in the same boat as someone that has ADHD and a leg amputation, for example. If someone comes to you, they work for you, it's a friend, a loved one, any of the above and they have ADHD, please take it upon yourself to learn and read about ADHD because there are infinite resources online. I think not having the expectation that people with ADHD should carry that emotional burden is really, really important. Remember that ADHD is a hidden disability. It is not fake. It's not a mental health disorder. It's a hidden disability. Providing flexible working arrangements or learning participation for people, accepting people for everything that they are, because often, in my experience anyway, and the experience of a lot of people that I know, or everyone that I know that has ADHD, there are things that we're really good at and we'll be the best at those things. And there are things that we're just not good at, never going to be good at those things, and that is just how it is. It's just how it is. So individuals with ADHD find easy things difficult and difficult things easy. We love a challenge, we love pressure, so utilise that talent in people and just not having the expectation that people will be the same as neurotypical individuals. If you think you have ADHD or someone that you suspect has ADHD, I guess these are just some pointers of things that I wish I knew because I would do things a little bit differently if I was to go back in time. So doing your homework and setting yourself up for success. You want to do your research about a GP that has a reputation of being empathetic and giving people time, progressive and patient, because it's already hard enough to get to that appointment. So do your research about that. Same thing about your psychiatrist. Do your research about the kind of care that you're looking for because every single physician is completely different in their approach. Share your experiences with people that you trust and people that you love. Even if it's just one person, I did not tell anyone about what was happening. I didn't know anyone else at the time that had ADHD, which is so funny because now 70% of my friends have ADHD. We're like magnets towards each other. Join a peer support group. So the thing about the peer support is that it doesn't have to be a physical group. There are Facebook groups online. There are groups on Reddit where people have discussions, people ask questions, people share their experiences, and that is so beneficial for the simple fact of knowing that you're not going through something alone or having a read of other people's experiences, because even though the symptoms of ADHD are similar, everyone has very different experiences. So, for example, medication worked very well for me, but I know people that are on the same medication and they say it makes them feel like a zombie. So it's not copy-paste. It's all very similar, but everyone's experiences are different and the peer support is very helpful. Just doing your own independent research, because I did not learn any of the things that I know from a doctor or a psychologist or a psychiatrist. I learned it on my own via social media and TikTok and news articles and podcasts. Keep a diary when you are navigating your dosage because, like I said, it's a roller coaster. Keeping a diary will minimise that. If you feel comfortable, disclose your diagnosis with your employer or your institution that you're studying with. I understand that not everyone has that as a privilege. I'm so lucky that I work at such an incredible organisation where everyone is so supportive and accepting of me. But I guess I'm just going to go against the grain here. I know it's not an option for everybody to change jobs, but if you are in a situation, in a job where you don't feel like you're supported, my suggestion is to get out of there and go work for someone who is going to understand what your needs are and be accessible and, accommodate for you in that way. It can be really overwhelming, but I like to think of your ADD as being accepted into Hogwarts. You're very special and very different and rare. So this is a photo of a whiteboard. So I spent $9 on a whiteboard that looks like this from Kmart, and it changed my entire life. I'm able to write everything down. I'm able to colour coordinate my appointments, my fun activities, my work commitments. Sometimes when I'm very busy, because obviously I've got two very, very busy careers, sometimes I'll write down next Wednesday you have to remember to wash your hair, stuff like that, exercise, and it is such a dopamine hit to cross off all the things that you've done and actually have a look at that. It's just juicy dopamine. It worked really, really well for me. So this is the ADHD Hall of Fame. I wanted to share this because all of these people are very well known and they all have ADHD. So is there anything about these people that you think they have in common? Just yell some stuff out at me. What do you think all of these people have in common? Sorry? Geniuses? Yep. Anything else? Yep. Any other observations? Yep. Not Emma Watson. Hermione Granger is on the list, guys. All of these people are at the top of their game. They are the best of the best at what they do. Some of these people were very troubled, very, very troubled, very creative, but very troubled, had the world at their feet, but, really, really struggled in their lives. So this is a really, really great representation of what ADHD is. So I'm coming to the end now, so thank you for your patience, everybody. I guess if you Google ADHD, there will be a lot of things that are very informative, but there'll be a lot of, antidotes and recommendations of how people with ADHD can manage their symptoms and, how they can manage their neurodisability and create habits that are more balanced. And this is probably a very unpopular opinion amongst clinicians, but I aggressively reject the idea of pursuing this strategy because to me it is so inauthentic. It's just masking on steroids. If you're someone with ADHD, I can't speak for everyone else. I can only speak for myself, but no matter how hard I try, this is not realistic for me. Nothing about my life is balanced, and that is just the way that it is. I think the whole idea of creating balance in your life is just encouraging people to conform to become more neurotypical, which is not really encouraging people to be their authentic selves. I often think about many facets that shape me as a person, and those are my branches and my roots. The things that define me are my character, my values, my culture, my upbringing, my education, my spirituality, my goals, my career, my wants, my fears, my passions, my needs, my interests, my intelligence, my family, my friends. These are all the things that make me me. They're the branches of the tree and, they're my roots. But my ADHD is the soil. That's the foundation in which these things can really thrive and grow, or these things can completely deteriorate. So I've shared a lot today about myself, which I've actually never shared before ever in my life. So thank you for sticking through it. So I've shared a lot today about my journey, but I think I just want to take a moment to acknowledge that at the core of my entire experience was my privilege. I grew up in a household where I had both my mum and my dad present. We never experienced poverty. I always had a roof over my head. I never had to worry about when my next meal would be. I went to the most prestigious school in the state. And I was working. I had access to a car. I had access to the use of my ability to speak. I can advocate for myself. I can communicate my needs. And there are just so many people that are not in that scenario. I mean, even my friend Toby, he lost his battle and he was a white cisgender male that came from a very loving family and had everything at his disposal, and he still lost the fight. So I just think that diagnosis and access to resources needs a massive overhaul, because there are so many people that will not have access to that treatment and that diagnosis purely because of their circumstances. So my hopes and dreams for the future, equity and inclusion. I would love to see options for bulk billed ADHD diagnosis and care options, specialised ADHD clinics for CALD communities and Indigenous communities, inclusion in the NDIS eligibility criteria. The fact that we are not included in the NDIS is shocking. More access to coaching, mental health support and peer support groups. I think the peer support groups are actually one of the most helpful components. Less social stigma and free access to streamlined holistic information for all individuals who are diagnosed or seeking a diagnosis. I think it should really be in schools as well because, as I said before, we heard about the boy that had ADHD. No one knew what ADHD was. He was taken out of the class and taken to a special education room, and he was completely isolated. None of us knew what ADHD was. Why is that information not being shared in the classroom so that from a young age we can all develop empathy and understand what's going on in the world around us? To conclude, I wanted to share a quote which I think perfectly encapsulates my experience in life and my ADHD. The best part of being authentic is that there is no image to maintain. You will delight some, disturb others, and none of it will concern the truth of your being. Thank you very much, everyone.
Okay, so we just wanted to thank Jamiela for being here and sharing her expertise. So Ishar has actually prepared a little bit of a present for her.
Thank you so much. Thank you.
And we do have a survey to do. I'm sorry, Leila, I think your laptop.
Oh, did it just look at something?
Yeah.
We've got a little barcode.
Yeah, we do have a QR code, so if you guys could just get your phones out and get your QR code scanner or the camera out, whichever one works on your phone, and just do a quick survey. That'd be great. Thank you. Okay, so while you guys are doing that, thank you so much for coming to Let's Talk Culture. And thank you, Jamiela and Leila, for being here with us today.
Thanks.
So we've hit the 1 o'clock mark, so if you guys would like, there's still refreshments at the back, and just chill out, have a chat with everyone. So yeah, thank you so much for coming.
Thank you.